He got his higher degree and postgraduate degree in functional orthopedics in Buenos Aires, and also a PhD in prosthetic dentistry at the University of Torino, and also posturology degree. He's professor and international director of MPR International School, Vice president of International Association of Posturology Switzerland. He also served as first lieutenant and director of the dental department of the Argentinian Army, and he received a postgraduate degree in functional orthopedics in '82. He's consulting and collaborating regularly in numerous clinics in Italy, United Kingdom, Switzerland, and Spain, as well as pursuing his ongoing researching and teaching activities through the MPR International School and in collaboration with other institutions and universities such as University of Sevilla, Spain, Master in Orthodontics, the Maimonides University in Argentina, the London School of Osteopathy, the Dental College of Dentistry in Sicily, University of Siena, as well as multiple ongoing projects with Universidad Abierta Interamericana, University of Havana, Cuba, and ICOM School of Osteopathy. So without further ado, I give you Professor Silverio Di Rocca. Please, you have the floor.
Okay, thank you so much. Can you listen to me? Can you hear me well? Yes?
Yeah.
Okay. I have to say thank you to your father to invite me, because it's a pleasure to me to be here. And I also collaborate with the new book you are doing. That is an important book, and I think it's very important to say that will be a very good book for dentistry. I will try to explain. Today is a very long topic, but a lot to relate to people who stay behind me made my job easy because they talk about something that is maybe interdisciplinary. And I will share my screen. You will see if my screen is seen now. Yes, you can see my screen. Yeah.
Yeah.
Okay.
Yeah, it's good.
Okay. All right. I have the next year. I have 72 years old, and I have 48 years working in the fields of medical sciences, plus 6 years of university. I had a lot of experience all around the world because I speak 4 languages. I speak Spain, I speak Italian, English, and French a little bit because it's not my most common language, the French. Dr. Bricot was one of my older teachers many years ago. I met him and I said I had a lot of teachers, all around the world, and that's why I was growing slowly a lot. In 1987, I met Dr. Bricot in Milan. I lived in Milan at the time. And then I went to Marsiglia to study posturology because I understood immediately that posturology is the way for interdiscipline. But at that moment, I understood something also, that all medical science, we do not have a common protocol. And you know what I mean in common protocol? If we want to work in interdiscipline, and I believe the only way to work is interdiscipline, and the only way to work is to know the whole body, not just one part of the body. The only way is to have a common protocol, a common language. And that's why many years ago, after I finished my formation in posturology, in 1995, I started to develop this MPR protocol that is called myofunctional postural rehabilitation. I will try to explain first, slowly, what is the protocol, because if it's not, you do not understand the vertical dimension we are found in. Dentist, I am 2 times dentist, but dentists look only teeth all around the world. Sometimes in the history, dentistry go out, the teeth go to the TMJs and stop in the TMJs. And I understood in all these years that it's very difficult to work if we do not understand the whole body, but not just the receptors of the body, the whole body. I will try to explain today the basic concept in NPR protocol. What is our concept of vertical dimension, neuromuscular vertical dimension, the importance of the balance, the dysfunctions. I will show you some case studies, and if you have any question, I will be here, no problem. But many, many years ago, I understood that synthetically, the problems, the diseases are divided in 2 big groups: dysfunctions and dysmorphisms. And if you understand that at the beginning, I think your way is very easy. Dysfunction is an alteration of the functionality. Very simple, the word is saying all. Dysmorphisms is alteration of the structure. And I may sometimes say an sample. If we know that's very common sample, yeah? And I hope he agree on it. Quasimodos. Quasimodos. Quasimodo is normal or not? Is in good function or is it not a good function? And if I want to try to put him straight, like Adonis, maybe I will create a disease on him. That's why we said we have to understand if our body is functioning well. We know very well that during the age, our body adapt because our body is an antiseismic structure. Diseases, aggression, intoxication, etc. are pushing us every single day, and we adapt. After 40 years old, adaptation is coming down. And in that way, we can compensate, or we can have a very big disease. That's why I said maybe Quasimodo was compensated and is healthy. And if I want to put him straight, I will create a problem. I love osteopathy because osteopathy have I study, perhaps, I have to study all in my life. I was listening to you for implantology. I studied implantology many, many years ago. It's in 1990 in Sweden. I did all in dentistry. But I also try to study what is physiotherapy, what is osteopathy, what is pedestrian, what is psychology. And that's why I create a protocol for the whole medical sciences. And I believe very strong that we cannot work alone. But also, we cannot work together if we don't speak the same language. And that's why I try to create a protocol with the same language in diagnosis and in treatment. And the things I understood was the first 3 questions any medical science have to ask themselves is, first, why something happened? This is diagnosis. Second is when I have to act. This is the priority. And last, how? This is tools, different tools. No, not only one. But the first question is why happened. is diagnosis. And all around the world, we lose the diagnosis. I am crying to say that, but I work in all around the world. I have contacts in all around the world, and diagnosis is the last. We go to act. We want to put the tools. I was listening to you, instrument is very good. But the other thing is, if you don't know what are following, you don't understand what you find. And you have to, I think, in the whole university, this is the thing I'm trying to do in my school, to teach common diagnosis. And myofunctional postural rehabilitation is this. And it's a method, it's a method for all medical sciences, not for dentists. You know why? Because I was in a congress like this many years ago, and I said, I know a lot of doctors, a lot of physiotherapists, a lot of osteopaths that they don't know the craniofacial systems, And all my colleagues make applause to me, say, oh, Silverio is a dentist, right, he's defending us. And I say, but I know a lot of dentists that they only know smile, and they don't know the rest of the body. That is the goal. And that's why I structurate a protocol to work together for all in 300 degrees. And the protocol is very easy. It's diagnosis and therapeutic methods. We use tools for all medical sciences, all disciplines. But the aim is to put in harmony, not the TMJs, and I will explain later, the craniofacial system with the tonic postural system. I was listening to my teacher, Bricot, he say the craniofacial system is not a receptor. I agree totally, but I understood that is a big disturber, the only big disturber of the tonic postural system. And if dentistry do not understand that, we never will have good physical rehabilitation. The craniofacial system is the big disturber. And that's why Dr. Bricot don't know that. And when I finished her lectures, I said, wow, I understood. At that moment, I say that is true. But if I cannot do the rehabilitation of my craniofacial system because the posture is disturbing me, I had to stop the work because I cannot do the rehabilitation in one day. And in that moment was a shock in my mind. I said, I have to discover something to annulate, not to treat, to annulate temporarily this big disturber to allow a good rehabilitation. And then when all is okay, I, as a dentist, will do a very good rehabilitation. And I will explain about how concept we have in rehabilitation. In rehabilitation, today I was talking about this, the craniofacial system. I am not talking about biochemistry, about foods, no, I'm talking how. When I finish the body rehabilitation, I have to find the jaw position and the vertical dimension. And in that position, I have to study with the teeth what I have to do. That is the moment to study the teeth, not first. We always study first the teeth. If you annulate the system, the biochemistry, if you annulate the foot, if you annulate the eyes, the things that are disturbing, mainly the mouth, if you annulate the mouth, the other medical science can do a very good physical rehabilitation. And then when they finish, our job will be to find the jaw position, the vertical dimension, and then build the occlusion. And in that way, we will not have any relapses. And it's not the technique, because rehabilitation means maybe orthodontics, maybe orthopedics, maybe orthodontics and prosthetic, maybe only prosthetic, all the tools we know. in that moment, we have to plan in which tool in dentistry we have to use. And that is I to try to explain today the concept of vertical dimension. And that is another problem also. Is another problem. This is triangle of the life. The balance is mind, structure, and biochemistry. We live in a world of intoxication. How we can do a treatment in the muscle chains if we have intoxication? We cannot. And structure is the last, not the first. If we annulate all the things before, I say to my students that the brain, just simplifying, the brain is as a PC. To receive information, esteroception, proprioception, even if receptors are working bad. But the only problem is our PC here has not antivirus. He received the information bad and do the answer bad. That's why I was thinking many, many years ago to put an antivirus, who I call that deprogrammation, annulating temporarily this bad, wrong information to allow us to do a good physical rehabilitation and then to treat the reprogramming. Reprogramming of all the things we need, because maybe if we annulate the aggression, the receptors reprogram themselves, maybe. But if it's not, in that moment, we have to reprogram the things. And then, in our fields, jaw position, vertical dimension, teeth. We do the reverse in dentistry. We look only teeth. I don't believe in first class, second class, and third class, but there's a polemic now, because I don't believe in malocclusion. I believe in disharmony. We don't call that in our school. We don't say malocclusion of first, second class. We say anteposition, retroposition. We say discrepancies, vertical discrepancy, sagittal discrepancy, transversal discrepancy, all related with dysfunction of the muscles. Dysfunction of the muscles. And we do clinical diagnosis, instrumental diagnosis, and complementary analysis. All medical protocols do that. All medical protocols do that. Any medical sciences. Talking about craniofacial system, and that is our topic today. No, our goal is to put in balance craniofacial system, not TMJs, not the jaw. Craniofacial system in balance with tonic postural system. That means with the rest of the body. We have all connected. We are not disconnected. All connected. Vertical dimension, we believe we have two vertical dimensions. Anatomical vertical dimension is easy. It's a structural vertical dimension. But the most important is the neuromuscular vertical dimension. And if we understand that that's a neuromuscular vertical dimension we call normally free space of relax of muscles, to obtain that, we have to have good postural balance, to have a local relaxed muscle, and in that moment, sometimes we are surprises, because from that situation of free space in balance with the body, we know 2 millimeters less have to be the vertical dimension, anatomical, but sometimes it's not relation, because it's abrasion, body, it was loose, a lot of things happen. And if we understand that, if we can put the vertical neuromuscular and postural dimension connected with the anatomical, all is protected. But if it's not, if we cannot, because we always cannot do everything. But if we understand before, we can protect our system, we can protect the craniofacial system and the rest of the body. This is the thing I am preparing for your father in the chapter of the book. Now I'm doing a little resume of that. This is anatomical. This is easy. It's answered mathematically. But sometimes that there is not coincidences with the neuromuscular and functional and postural dimension. It's a functional vertical dimension. Anatomically, from the relax of the muscles, it's 2 millimeters. You take 2 millimeters, this is the anatomical vertical dimension. This is the occlusion. You have to create the occlusion there. But sometimes we cannot. More chronically is the problem, less we can do that. That's why we always said to everybody, prevention in childs, craniofacial and myofunctional and postural orthopedics, not orthopedics, not functional orthopedics, craniofacial, myofunctional and postural orthopedics. If we do that, and I will show you cases later, the adults will be healthy. And to obtain that, we need absolutely interdiscipline. We need the osteopath, we need the doctor, we need the physiotherapist, we need the dentist. Everybody, we speak the same language and we work together. This is our protocol. It's very important. It's a very simple instrument to reprogram. This is very easy to reprogram the jaw position. That's no. But the neuromuscular vertical dimension is something related with function, muscular functions, and posture. We cannot do that only treating, just locally. That's very important. It's a physiological vertical dimension, nothing to do. And we have to have the receptor imbalance. And if we don't have the receptor imbalance, we never can do a good function of the craniofacial system. That's why I invent that protocol, to work together, to work every medical science together, speaking the same language, but mainly in growth. I am fanatic to prevent in growth because I know there we help the adult in the future. We're talking about TMJs. Listen, you are happy if I tell you I am a specialist in this finger only? No. Better if I am a specialist in the hand, no. Better if I am a specialist in the whole body. And we say I am a specialist in TMJs. No. TMJs is part of craniofacial system. It's not TMJs. It's a joint, a special joint, but it's part of the craniofacial system. That's why we said craniofacial system balance, not TMJs. And we know very well TMJs under pressure start the disease. Make resist traction, little traction, not pressure. But we have to find the craniofacial system balance and the body balance. And this is our goal. No? The craniofacial system is brain, stomatognatic system, teeth, harmony. We found harmony. Harmony in the whole body, not just in one part. During the growth, we know how the system grows. Here we have to talk about epigenetic, we have to talk about growth, or a lot of things. We don't have time to talk about that. But the main thing is muscle change of the body are disturbing when the jaw is not centrated. And somebody say, why? You know why? Because when the jaw is not centrated, it starts increasing the pressure inside the joint. And if increasing the pressure inside the joint, we have a special proprioception there, because they know increasing the pressure, there is a disease in the TMJs. Alarm to the brain. Brain is very automatic reaction. Starting the bruxisms, he said, something is blocking the jaw position. The teeth we have to go to destroy the teeth. Very bad reaction, because it's starting blocking of the craniosutures, blocking of the craniosacral breathing, hyperactivity of the muscle, blocking the neck, and slowly, slowly creating to the teeth a problem. That's why we have to understand the craniofacial system, not the TMJs, not only that. And then when we have all the things, we have to create an optimal occlusion. And I don't have time to talk about what I mean about functional occlusion. No, because it's not a static. Everybody told that, not a static. But in 2 millimeters of the occlusion, we are fighting for the health of the body. Is overjet and overbite. If we have interferences there, bruxisms start, because body is freedom of movement, is not static. This little space, the brain said, have to be free, have to test it free. Swallowing, we test during the night, we said destroy it. Bruxisms. And start the big problem for the whole body. And imagine, bruxisms in the child is physiological. Look at the nature. In the child, have to brush to stimulate the growth. In an adult, no. Thus, I have a very nice video about bruxisms. No? But this is the age. This is the age where we can prevent. The oral corridor, that is buccinators, lips, menton, tongue, breathing habits. If those are in balance, growth is in balance, is balanced, and teeth goes along to the exactly position. We don't need orthodontic. Malposition, not malocclusion. Malposition or bad position of the teeth is a symptom of an imbalance of the oral corridor and the craniofacial system. It's a symptom, it's not a disease. And we are treating the symptom, moving the teeth. We are doing aspirin for an infection. That's terrible in dentistry. We believe that malposition, everybody call malocclusion. Bad position of the teeth is a disease. No, it's a symptom of something who here are not working well, and who in posture is not working well, is reflecting in the structure. All this hypertonic, dysfunction, etc., are creating the problem in the structure. Breathing, swallowing, habit, all these things are creating problem in the teeth. And dysfunction of the muscle chain reaction from the top to the bottom to the top. Habit. In war, these changes, if you understood, affect directly the structure. And who lose? The structure. Ever lose the structure? The muscle win. The muscle deform the structure. Structure is static. And imagine if we add the mind, the biochemistry, all these things, we cannot have a good rehabilitation doing only teeth. We are doing restoration. The restoration is good. I understood that. Restoration, no rehabilitation. Rehabilitation is to make the things working like before. If we don't do all the balance, we never will do that. Particularly in growing, particularly there, we have to study the lip dysfunction, the chin dysfunction, the respiratory dysfunction, the swallowing, the postural dysfunction, the negative habit in the child we have to prevent for the future. All dysfunction are creating alteration of the growth, disruption to the growth, compression of the jaw, alteration of the premaxilla, dental-alveolar alteration, mandibular position changes, postural changes, and TMJ disorder in the future. That age, if we treat, I see all my colleagues when they say, a child say, wait, when they change the teeth and we will put braces and it's finished. No, I can put braces every time in my life. It's not the limit. Growth is finished. And if we don't act during the growth, we condemn a human being to a disease. But study craniofacial orthopedics is very difficult. We have to understand habits, growth, dysfunction, posture, etc., etc., etc. It's more easy to learn biomechanics. I put some braces, some expansion, and very easy. That I teach my students 2 days to do that. But they live 3 years with me learning craniofacial orthopedics. You know why? Because in dentistry, all can be relapse. Growth, if we make a mistake, it is not relapse. If we make a mistake there during the growth, we condemn the human being for the whole life. If we relapse in an orthodontic treatment, I can do again the orthodontic treatment. If some prosthetic broken, I can do again the prosthetic again. If I make a mistake during the growth, it's not recidiva. That's why it's very difficult to understand craniofacial orthopedics. This situation, if we don't treat it, will arrive like an adult like this. And here I can do nothing. But in that age, you saw, with craniofacial orthopedics, with this device only by nighttime usage, we can do this. That is magic. Making the function slowly, slowly. And if I have to do an orthodontic treatment now, it's very easy, very simple, and non traumatic. And sometimes I don't need orthodontic if I work in prevention. Deprogramming, balance and reprogramming. This is our protocol. Always. The bed device is a device that I invented many, many years ago to deprogram. And I don't call bite because everybody says a bite. No, it's bed. Body equilibrium device. It's a device with a special concept with a thermoplastic material who adapt with the temperature of the body and maintain the system annulated. And that allows the whole physical rehabilitation to go good. And then after that, we do our job. Bed is a deprogramming device. It's only one size, thermoplastic. You can adapt to everybody. We use in orthopedic also the same device. In childs, we can modify anytime you like. This device is creating a good deprogramming. And then study the posturology and the posturometry. With the posturometer, we can measure if our treatment is disturbing the body posture. And we can do diagnosis, we can follow the treatment, and we can see if we are going well or bad. Instrumental diagnosis, very simple diagnosis. Simple, have to study how to do a diagnosis. No, very simple instrument. And the reprogramming, the reprogrammer, or we can use also microplanes, etc., etc. We call that progressive. Progressive. We are habituated to do all quick. We do not respect anymore biological times. Never is quick. We have to do it slowly, slowly, finding the job position. Reprogramming, slowly, progressive, not in 1 day, 20 hours, 2 months, 3 months, the time you need. And then after that, occlusion. This is the tools we use normally. This function, deprogramming. When we deprogramming, we annulating the muscle stress. the jaw is going automatically to the relationship, the central relationship. It's easy. To obtain that, we have to relax the whole muscle body. And the jaw is going automatically centrated. We have to find the vertical dimension. In that moment, reprogramming to find the vertical dimension where we will build the occlusion. This is our protocol in simple words. No studies. This guy, this is prosthetic, just prosthetic. One case of prosthetic, the vertical dimension. No, but look at the posture. 14 kilos of overload before, and he finished with 5 kilos. An adult. All body balance in equilibrium with the craniofacial system. This is the goal. If I know how to build a functional occlusion, that is permanent for whole life. Other patient, complicated patient, with the losing of the vertical dimension, chronic patient, we do another way, another way. This was the beginning. We do something like this to create the vertical dimension with the rest of the body in balance. It's just a simple job, simple job. But that patient is healthy. You don't need a lot of money. You have to think. You have to discover what is the problem. One is simple things, you can do everything. Bed therapy, I told you. Look at the deprogramming. Patient with posture, after the programming, 7 kilos, 0 after the programming. Just the programming. But I am not saying it's cure. I am annihilating the system. Now they have to work. Look at 4 kilos, 0. The whole system, 5 to 0. A lot of cases I can show you. 4 to 0, 1. Convergences. We see all. We see the diagnosis. I don't talking about diagnosis, no. We see a lot of diagnoses: clinical diagnosis, stomatogenetic diagnosis, biochemistry diagnosis, food support. All. We study diet. We study intoxication. We study how to clean the body, not just to put the teeth or to put some physical therapy. Look at that. 0. 5 to 0. All is the same. The 1 to 0. 4 to 0. We measure if our system is making interferences with the rest of the body. If it's not, rehabilitation will be good. And this is the goal, orthopedic. These devices, I invented devices, is a myofunctional and postural regulator that the child used during the nighttime. That is a special concept. I cannot explain that today, no, but special concept. Annulating the dysfunction is this device is deprogramming and reprogramming automatically, because in a child, I have to use the growth. I cannot wait the deprogrammation and then the reprogrammation. This device, the programming and reprogramming, and the specialists, osteopathic, all other specialists help us for the posture. Look at that. This is slowly is changing. A very simple device, nice device. And then if we need orthodontic, it's very simple orthodontic. Look at that. That device, how it's changing the scoliosis. I took that picture because I'm not saying it's curing the scoliosis, but look at how it's better. Annulating the mouth. Craniofacial system is a big disturber of the tonic postural system. That is the thing I want to introduce to the dentist. We have in our hands the future of the patient if we follow a good protocol. Look at this is orthopedics, craniofacial orthopedics. If we need orthodontics, very simple, very easy, no? Because we annulate the cause. What is the dysfunction? No? Look at. Close the open bite. An appliance using during the night time only. Exercises, osteopathy treatment. Look at how they change. how this crossbite is annulating with this device. No braces. And then we will see in the future what we have to do. Look at how we're changing the muscles, we're changing the neuromusculars, deprogramming, reprogramming, consolidation with the occlusion. This is our goal. This is my CV. You're talking about that, yes. And if you have any question, this is my webpage, and this is my email if someone want to contact. I hope I was very clear in a short time to explain a very, very complex treatment.
Professor Di Rocca, thank you so much for your presentation. I'm glad that we are closing to be on the same page. Of course, you have the vast experience, but I feel sometimes when I see patients, especially kids with dysfunctions, that something is missing, and I truly hope and believe that maybe your system will assist me to provide them a better treatment option rather to do some complicated steps.
I hope we can start some formation in your country, and we're very glad to do that in your country. No problem.
Yeah, for sure. If we speak about kids and especially kids with problem, normally everybody's running away from kids with problems and maybe running towards more financial attractive solution. But for instance, as I said before, with the neuromuscular approach, I have applied some techniques to kids, and the kids start telling to their mom instantly, "Mom, I breathe better. Mom, I have a different position. Look at me." And that's only by not touching the patient and just by listening a little bit the brain or the muscles. So I truly agree that there are a lot of situations when bones are in a completely different left to right, but the muscles are still there. I strongly believe that we should listen and also take consideration to the neural system, because the nerves will still be there, the muscle will still be there, the teeth or the bone can easily be gone, but we for sure will have the tongue left, we will have the muscles helping or impeding us having a correct position.